Our case report is on littoral cell angioma, which is also known as LCA, and it's a rare vascular tumor, and it is, in our case, it was in the spleen. It's mostly a benign case, and in our case it was a benign case, but it could also be malignant. Currently, there are less than 200 cases of LCA that have been reported worldwide, so as we all know, it's a rare case because of the fact that our patient, who is a 63-year-old female with a history of stage 2 multiple myeloma and rheumatoid arthritis, she had to do splenectomy, and she had to go through the removal of the spleen, and she was presented for left upper quadrant pain while she was receiving daratumumab, Velcade, Revlimid, and dexamethasone for her multiple myeloma case. And she had no history of alcohol use, tobacco, or other drug use, but she was presented here for the pain, and she had to go through the splenectomy. And also to add that the littoral cell angioma has a relationship with either a histological malignancy at 30%, which in her case, she did have a histological malignancy, which is multiple myeloma, and also a immunological dysregulation, which in this case, it was a rheumatoid arthritis, which is an autoimmune disease.
Littoral cell angioma presents, like in most cases, non-specifically, and on radiographically, it's also, you cannot use imaging like CT or MRI to differentiate it from other splenic masses, either benign or malignant cases. So that's why a splenectomy is done, and the spleen is observed afterwards for any abnormalities. In this case, histological and immunophenotypic testing was done to confirm the diagnosis. And in our case, when the lesion was looked at under a microscope, we saw irregular vascular lesions on the mass that was found, and also anastomizing channels. And in addition to that, on the immunohistochemical testing, it tested positive for CD68 and CD31, showing that it has both histocytic and epithelial character. So those all together really give you a definite diagnosis of littoral cell angioma of the spleen, because you cannot reach a definitive diagnosis with regular imaging. As my colleague mentioned, there have been less than 200 cases reported worldwide to date of this on this disease. However, and because of that, we don't really know the biological basis of pathogenesis of this disease in detail. However, increasing data points out that there might be some immune dysregulation behind its cause. And this is because littoral cell angioma is closely related to solid tumors, hematological malignancies, and also immune system disorders such as Crohn's disease and Gaucher's disease. In specific, in a study of 25 cohort study of 25 LCA patients, 60% of them were found to have co-occurring epithelial or hematological malignancies. And in our case, since our patient had a history of multiple myeloma and rheumatoid arthritis, both of which are to some degree immunological disorders, it further points out to the fact that the immune system deregulation might have contributed to the pathogenesis of littoral cell angioma of the spleen in our case. And I think overall, our case report sheds light on the fact that in cases where imaging or other clinical presentation points to the fact that there might be a splenic mass, littoral cell angioma should be considered in the differential diagnosis, especially if the patient has a history of malignancies or other immune system conditions. In addition, our case report adds to the existing but slightly limited literature on LCA's association with hematological disorders and immune system disorders. The main thing about littoral cell angioma is that it's a very rare case. Less than 200 cases have been reported worldwide. So definitely more research and thought needs to be taken into it. But we're hoping through this case we'll bring it more into light so that it can be studied furthermore.